Emergency first aid, how to suture. Imagine a situation where someone has a deep cut and professional help isn't nearby. Knowing how to suture can make a big difference in such moments. It's a skill that helps close wounds, stop bleeding, and prevent infection. But suturing isn't something to take lightly. It requires careful preparation and a steady hand. First, you need to stop the bleeding by pressing firmly on the wound with a clean cloth or gauze. Once the bleeding slows down, gently clean the wound with clean water or saline solution to remove dirt and debris. Avoid harsh chemicals like peroxide or iodine because they can damage tissue. Check if the wound is suitable for suturing. If it's heavily contaminated, a puncture wound, or involves animal bites, it's better to wait for professional help. Gather your materials next. Wear sterile gloves to reduce infection risk. Prepare a needle driver, which is a small tool to hold the needle, tissue forceps to handle tissue gently, sterile suture thread, and scissors to cut the thread. Choose the right suture material. Absorbable sutures are used inside the body because they dissolve over time. Non-absorbable sutures are better for closing the skin since they stay in place longer. If you have access to local anesthetic like lidocaine, use it to numb the area. This makes the process less painful and helps you work more precisely. When ready, load the curved needle onto the needle driver about 1/3 from the base. Start at the center of the wound to keep tension even. Hold the needle perpendicular to the skin and push it through about 1 centimeter from the wound edge, passing through the dermis but not too deep. Pull the thread through, leaving about 2.5 centimeters of tail. Reinsert the needle on the opposite side, mirroring the entry point, and pull the thread through without pulling the entire suture out. Tie a secure knot by wrapping the suture around the needle driver and pulling tight. Cut the excess suture, leaving a small tail. Repeat this process with stitches spaced evenly along the wound. Each stitch should be independent to allow for better healing and infection control. If you're trained and equipped, you can try advanced techniques like mattress sutures, which are useful for wounds under tension, or running sutures for faster closure. Buried sutures can be placed in deeper layers for stronger closure and better cosmetic results. After suturing, apply antibiotic ointment to help prevent infection. Cover the wound with a sterile dressing and change it regularly, especially if it starts to drain. Keep an eye out for signs of infection like redness, swelling, or pus. If the wound is large, dirty, or involves joints or tendons, seek professional medical help as soon as possible. Remember, practicing proper hygiene and technique is key to avoiding complications. Always use sterile equipment when practicing or performing suturing. In an emergency, knowing how to suture can help save lives, but it's best to get professional medical care as soon as possible.